Good morning, everybody. I'm Dr. Divya Nair, Director at IDinsight, and along with my colleague Aditi Gupta, I'm going to present some of our findings from work that we're doing with Niti Aayog and SIF to support the monitoring of Poshan Abhiyaan in Rajasthan and Jharkhand. In terms of the pathway to impact, we're conducting several rounds of quantitative and qualitative surveys around health and nutrition indicators over 1.5 years. And the goal is really to support evidence based decision making at state and national levels. In terms of methods and analysis, we used voter rolls as our sampling frame. We selected 12 districts from across the two states, and we're representative of pregnant women and mothers of children 0 to 3 years across these two states. In terms of the information we collected, it ranged from supplemental nutrition to minimum dietary diversity and access to relief. In terms of timing, we collected information early this year, and that was in person. And then after that, we collected information via phone surveys during the lockdown. Effectively, we have a pre-post analysis, which is pre-COVID and post-COVID. And overall, we have around 2,000 respondents in the first round and around 1,100 respondents in the second round. I will now hand over to my colleague Aditi to share some of the results that we are seeing. Thank you.
Thanks, Divya. I'm going to talk about 4 main findings from our survey. The first 3 findings are coverage indicators from take-home ration, iron folic acid, and relief distribution during COVID. And the 4th indicator is an outcome variable of minimum dietary diversity requirements among children. On this slide, you can see that we find the THR coverage drops by 7 percentage points during the lockdown. The drop in Jharkhand is much higher at 11 percentage point, but the coverage of Jharkhand is substantially higher than Rajasthan, where it stands at 56%. We also find that the THR distribution is better targeted towards poorer and tribal households in Jharkhand. Moving on to our next indicator, we find that the distribution of IFA tablets dropped for mothers by 12 percentage points before and after the lockdown, and currently only 11% of the mothers are receiving the IFA tablets. This drop is similar across both the states. We also find that only 7% of the mothers have reported receiving IFA syrup for their children as compared to 19% before the lockdown. I'll now move on to my third indicator of relief distribution during the lockdown. We find that about 62% of the households reported receiving any kind of relief, be it cash or in kind. And an in-kind relief includes food from PDS, hot cooked meals, THR, etc. You can also see that the coverage is higher in Jharkhand, where it stands at 77% as opposed to Rajasthan, which is at 58%. We also find that the relief distribution is better targeted towards poorer households in both Jharkhand and Rajasthan. The last finding which I want to talk about today is minimum dietary diversity requirements among children. We find that only 6% of the children are receiving good quality foods which meet the minimum dietary diversity requirements. This is concerning, and there is a huge drop of 15 percentage points from the pre-lockdown time. You can also see that the drop in Jharkhand is much more substantial, and it has dropped by 32 percentage points from the pre-lockdown time. Coming to the policy implications of our study, I'd like to present 4 areas through which this evidence can be used. First, all the essential health and nutrition related services should resume, especially the distribution of THR and IFA. Second, there should be an increase in communication strategies related to nutrition, starting with Poshan Ma, to push for dietary diversity among young children. Third, all these efforts should be complemented with increase in relief supports, both in cash and in kind. And last, there should be an extended support to the rural economy to increase income so that households have more ability to increase their food intake and the food quality. Thank you everyone for hearing us out, and we hope to answer any questions during the discussion afterwards.